Hello everyone, my name is Marco Mejia. Today I'll be showing you guys how to do a modified 10-20 system for our sleep studies. This is Genevieve, she's going to be helping me out. So the first thing you want to do is to start from your nasum, which is at this point it's like the bridge of the nose, and you'll measure to the inium, just towards the occipital bone of your skull. And then it looks like we have a total of 38 centimeters. That's the measurement we'll be using. And then from the nasum, you'll go 10% of your totals. So you'll go 3.8 centimeters to your FPZ, and that's this mark towards the middle of the forehead. And then we'll go 20% from that 10% to get your FZ. That'll be about right here. And then for me, we'll go another 20% just to get the CZ. We'll do that. So you go another 20% right here, CZ. And then I prefer to grab the end again. I'll start from the inium. I'll go up 10% to get the OZ, and then I'll go up 20% to meet right back at the CZ. Alright, so the next step is we'll measure from the preauricular. It's at this flap towards your ear. So we'll measure from here, and we'll go from preauricular to preauricular, and you'll get 33 centimeters. And then from your baseline, you'll go up 10%, and then from that 10%, you go another 20%. Which will be your T3. So from the 10% is your T3, and then when you go to that next 20% is C3, and then we'll start from this other side. You go up 10%, you'll get your T4, and you go up 20%, and you'll get C4. And pause. All right, so the next part is we'll measure the circumference of our patient's head, just starting from the FPZ. You want to follow your marks, follow your T3, passing the OZ, passing the T4, and then back there. And the patient's circumference is 60 centimeters, perfect. So then the next step will be starting from that FPZ and going about 5% of that 60, which would be 3 centimeters. So that would be your F1, and then same thing, you'll start from FPZ on this side, F2, 3 centimeters, F2, and then from, same thing, start from that F1, and you go 10% to get your T7, F5, and then same thing, you go from F2, go 10%, and then you'll get your F6, and then you already have T3 and T4, T3, T4, and then next you'll go from your OZ, go 5%, it's about 3 centimeters to get your O1, and then your O2 on this side. You go 10%, you get your T7 on the patient's right side for 10%, and you'll go ahead and get T8. Pause it. Sorry. Alright, so the next step is that you want to use your EOGs, so it's going to help record eye movement for a REM cycle, one on your left eye, one on your right eye. And then your EMGs, so you'll have 3 on the chin. You'll have 1 right here, and then 2 just below the chin. And you'll have some on your legs. It'll be just inferior to the patient's patella. You'll ask them to flex their leg, and you'll see muscle flexion across the tibia. So you want to place your leads there. And then you need a snore mic as well that'll go right here on the patient's throat. And then you need an SpO2, goes on their finger probe, connects to their wrist, I believe. and then an EKG, one here, and then it's cannula to help record temperature and patients relieve their flow, and then the thermal transducer is and the grounds. Okay. And then you also have your grounds, it'll be your M1 and M2 just right here behind the ears. You'll feel like a prominence that sticks out. And yeah, that should conclude this presentation for the modified 1020 system.